Hello, everyone. I'll be starting promptly right around 9:30ish. Um, so before we start, just wanted to see if anybody had any questions on any of the topics that were discussed previously. Okay, so um, the purpose of this presentation is really just to review some of the over-the-counter medications and dietary supplements that you would see on um, during while you're at work or during practice at community pharmacy and at other health food stores as well. Um, I'm also going to go over a little bit about the devices to administer medications and self-monitoring tests. Specifically, I think one of the ones that I'm going to discuss in this presentation is just going to go over um, the um, inhalers that would be typically used for like breathing. Um, so we'll take a look at that. If anybody has any questions, my name is Nehal Desai, and I'm gonna be go over this stuff. Feel free to comment or ask any questions in this chat during this presentation session. Um, it's not a whole lot of material here, but at least you'll have an idea as to um, what to look out for whenever you're counseling patients on these types of medications. So, like, these are some of the devices patients would use to administer medications. In MDI and DPI, you might see them being used similarly, but there's some differences as well. So it's kind of important to note those differences there. Nebulizers, um, spacers and holding chambers, auto-injectors, insulin, ophthalmic eye drops, um, and the audit drops for the ears. So these are some of like the devices you would consider um, as being used to administer medications. Um, Certain cases, patients might come up to um, see what kind of eye drops to use, and there's certain types you would probably see are certain things like Visine or Cysteine or Pataday, and these are the most common ones you would see over the counter, especially for those patients who are having a red eye or rash, or have some kind of itchy eyes. Um, so administering those, knowing how to administer those kinds of medications are important as well. Um, so it's always important to know how to counsel a patient, understanding how to use those kinds of drops. Same with ear drops, have to know how to administer those as well. But I'm not going to go over these in this presentation. We will look at that in the future presentation. Right now, I'm mainly focused on the MDI and DPI overview, and partly nebulizers, because you'll probably see it, you may or may not see it in practice, but there is a lot of patients who might be on an inhaler, and they might not know how to use it properly. So it's always important to understand how these kinds of inhalers are used. So I'll be just going over that briefly with you all. There's also one other type of inhaler, which you'll see in a few sections how that's used as well. So this is just a diagram of some of the common types of devices that patients would use to administer or self-administer medications. Um, One thing to be careful of is certain patches, they cannot be cut. Um, so it's definitely important to kind of help patients understand that. Um, Also, when it comes to insulin injections, to properly administer those, you can see here also kind of like the little puffer, the inhaler. I'm used to puff it. Um, and then on the right, there are certain types of nasal sprays. That's another type I haven't really discussed in the list there, but nasal sprays are also another type of device patients might be having trouble using. So it's always important to understand how those are used as well. And then I also laid out the eye drops here for you all to see, and ear drops as well. Notice how in the picture how this um, eye drop is being used. You can see here where like you're supposed to move your head back and pull the bottom eyelid down, and then put the dropper or the drop inside without touching the tip of it. So, and then just close it, and then um, just following those directions there. And then eardrops, you have to do it while laying down, um, so that it can get inside the ear. Um, so yeah, so these are some of the things. When it comes to insulin, also being cautious as to, definitely knowing how much insulin to inject, because when it comes to insulin injections, it could be administered in units or milliliters, depends on the syringe that the patient might be using. So those differences are important. Um, so knowing that is important to understand as well. Over there on the right, next to the eardrops, you can see the nebulizer machine. Um, Certain times patients have to pour in the nebulizer solution into the machine, and then it will allow it to pump into the system, uh, or out of system, to get to a patient. So, it's important to know a little bit about that as well, how the nebulizer is used in this case. Let's see here. So when it comes to a metered dose or metered dose inhaler, basically these are like the steps you would just follow through. First is you would take the cap off, shake the inhaler well for about 5 seconds. Then you would just stand up straight or sit straight, and then tilt the head back. Exhale away from the inhaler, and then put the inhaler in the mouth and press the inhaler and start breathing in at the same time, slowly deeply for 3 to 4 seconds. Um, in certain cases, when it's like the first time you're using metered dose inhaler, it's always good to prime it by at least spraying it away from your face as well, away from your head, um, so that you can see if it works properly. And then you would just start using it as shown in these steps. Um, so it's always important to at least check to make sure that inhaler is properly configured before using it. Definitely want to hold your breath for 10 seconds after you have inhaled that medication inside, and then exhale slowly through your mouth and nose. And then you would wait 30 seconds or longer if another dose is needed. So essentially, that's all you would do here when administering a meter dose inhaler. One thing about the inhaler here that actually makes it different from the DPI, the dry powder inhaler, is that DPIs, you don't shake it. You shake the MDIs before using it, but you don't shake the DPIs. That one you have to breathe in really fast. So similar types of steps, but a little bit of differences here. You would definitely open a cover and then load the dose of medication as shown in your instructions. Do not shake the inhaler. You would stand up or sit up straight just like you would do with the MDI. And then place the mouthpiece of the inhaler in your mouth. Close the lips around it to form a tight seal. And then you would do a fast, deep, forceful breath. You would count it to 10 seconds, and then you would take the inhaler out of the mouth and breathe out slowly. So similar steps as the MDI. The only difference is really here is you do not shake the inhaler. And you would definitely hold it in ways so that the mouthpiece would go around it, and then pretty much want to get that drug inside. So that's the one difference there. And a lot of times patients tend to forget to shake the MDI prior to use. So it's very important to be counseling patients on that as well. So here's another example that dealt with one of the other types of medications patients might take, like Spiriva. This one's a little bit different stepwise. You would basically remove the clear base, you would go insert the cartridge, and you would just snap it down as firmly as you can, and then you would replace the clear base. And then you would turn it, and then you would open it, and then press the dose. So there's a lot of steps, but this is how you would do it first use, and then when you have to use it again, you would just do these three steps: turn, open, and press. And essentially, these are one of the devices that patients have a hard time using, so it's always important to know how to set it up for them so that they don't have much trouble in using this type of device for their breathing conditions. And then, so I have a couple of questions here that maybe you all can use as a practice for exam and so forth. It will just go over basically all this asthma and COPD types of devices. So first question here is, when using an MDI, what is the correct technique for inhaling the medication? So you can see here there are four choices. First choice, breathe in quickly, then exhale immediately. Breathe in slowly and deeply while pressing the canister. Breathe in and out rapidly through a device, or hold your breath for only 2 seconds after inhaling. So, this case, as you can see, you don't breathe in quickly. This is MDI, not DPI. And so answer here will be B. You breathe in slowly and deeply while pressing canister. And then why spacer recommended for use with MDI. So I don't think the medication is going to taste any better with the spacer. It's just going to help keep it under control, but it's not going to, you know, make it taste better. So obviously option A is out. Option B says to keep medication cold. Option C says it reduces medication deposition in mouth, throat, and increased lung delivery. It increases the speed of the spray. So obviously, some of these kinds of questions, when it comes to these types of questions, it's always a good idea to just eliminate the answer choices that really won't make much sense. And you can see here, C is the answer. What should patient do immediately after using an inhaled corticosteroid MDI? So you can look at that. How long should a patient wait between puffs of the same medication? So, typically you want to wait between at least 30 seconds. But that time period is not listing any of your answer choices, the next best answer would be B, would be 1 to 2 minutes. And then what is the correct order of steps for using an MDI? So you can take a look at this. And then which of the following is a sign of MDI canister? That this MDI canister is empty. Obviously, when it becomes that red indicator, the dose counter reaches 0. When using a spacer, how many puffs should be placed into the chamber at one time? So always do 1 puff at a time. And then if a patient's prescribed both a bronchodilator and a corticosteroid, which should be used first? Always use the bronchodilator first, then the corticosteroid, because that's going to help dilate into, like Chase, it kind of opens up or widens the bronchioles. So, and then you will use the steroid inhaler. What is the common error when using MDI? As I mentioned, shaking inhaler. Is really what happens when patients forget. So it's definitely a good idea to let them know that to shake the inhaler before using. So obviously, failing to shake is going to be the answer here. What should an MDI canister, or how should an MDI canister be cleaned? Yes, it's going to be answered that. And then self-monitoring tests would be things like glucose, blood pressure, peak expiratory flow, ketone test strips, cholesterol, or pregnancy test, pulse oximeter. Some of these tests really require some additional attention, especially when it comes to glucose and blood pressure, and trying to maintain those kind of ranges, and cholesterol as well. So it's important to know how these types of devices are used as well. I won't be going these kind of things in depth on this in this presentation, but I have noted a few things here. You can see in this diagram here, some of them like the peak expiratory flow, showing how well the asthma is under control. Um, and see how when it comes to like glucose test, you can see how in this picture here how a test strip is being used to measure the glucose. Definitely, patient who is needing to test for blood glucose, they would need a monitor. They would need the lancet. They would need the lancing device for that would prick the finger, and then they would have to have a test strip so that the drip of blood can go on the test strip and then go into the monitoring device to um, test the sugar levels. So it's important to let patients know how those monitoring devices should be used, and what kind of test readings that they should look out for when they are monitoring using these test kits. So that's something to consider. Blood pressure as well. Um, when the blood pressure is too high, let patients know what high blood pressure means, um, what the reading should be, which what systolic and diastolic ranges to look out for, and all of that. And then this slide just represents like the number of like different types of over-the-counter and dietary supplements. Patients might go to ask you a question about what the best OTC medications are, or where to find these types of OTC medicines. Um, just a few tips or notes on the bottom here is when it comes to Tylenol, is depending on the packaging, brand or generic, maximum 4 grams per day is usually recommended here. Um, not to exceed that 4 grams because it might lead to more of a liver damage. And so it's always important to let patients know that, if they're on any other medications such as Percocet or Norco, that, to be careful when, before taking additional Tylenol because of that 4 gram limit. So, um, just helping to understand that as well. Aspirin, avoiding it in children 16 years or younger because of Ray's syndrome. And then NSAIDs definitely might lead to chances of GI bleeding risk and renal risk. So, because it's going to constrict the afferent arterioles of the kidney. So, definitely want to um, keep patients informed about all these warnings um, prior to taking these medications. Also, considering some drug interactions that might occur when the patient's on these medications. Um, and then they're taking over the counter medicine on top of it. So, these are some things to look out for. And that's pretty much it. Does anyone have any questions so far? No? I'll be posting some more information on these topics soon, so just um, let me know if you have any other questions. But thank you for watching, and hope you all have a good day or good night. And then we'll be sure to keep you updated for more. Thanks. Bye.